Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the 99th weekly update on the COVID-19 pandemic. This week, I'll address two questions: what is happening with the pandemic globally? And then a question that came in from a viewer this week is, should I mix and match my boosters? So what's happening to the pandemic globally? You'll recall that we were watching cases. They appeared to be sneaking back up after the Omicron spike, but now they're clearly coming down globally. And in terms of deaths globally, we're actually at the lowest point we've been since the very earliest part of the pandemic. Over 6 million official deaths to date and about 3,500 deaths a day. So while that's coming down, that's still a lot of people dying. If we look, we were following cases in France, Germany, and the United Kingdom. We saw cases going up for several weeks, but now they appear to be coming down. Conversely, the number of deaths appears to be creeping up. But again, that's probably just because deaths lag a couple of weeks behind cases. So hopefully what we're going to see is that they both will start coming down fairly soon. In the US, the Omicron spike is clearly over. And in terms of deaths, we're actually at the lowest point we've been since the June lull of last year. So hopefully we're going to see a continued lull and perhaps not a resurgence, though I think it's a little optimistic to suggest that that won't happen. Over 1 million deaths in the United States and about 470 deaths a day. Again, much lower than it has been, but still not a number that we should be comfortable with. In terms of where it is happening in the US, of course, we watched that Omicron surge go up very quickly and come back down. This is cases. And again, really, there's no real clustering other than perhaps in the eastern part of Kentucky, but we'll keep an eye on all of this. But for right now, it appears that both cases and deaths are coming down. In Tennessee, we're seeing, of course, the Omicron cases appear to be over. Deaths may be creeping back up. Tennessee, as we've said before, is a little difficult to follow. 25,000 deaths, 200 deaths last week. But the week-to-week deaths vary so much that it's a little bit difficult to get a sense of a trend, but we'll keep an eye on that little uptick there. In terms of the ballot health service area, we're actually at the lowest point again that we've been in terms of inpatient hospitalizations since last June. So overall, I think we would say that the pandemic is slowing down, both in terms of cases and deaths. Again, that doesn't tell us what's going to happen in 3 to 6 months from now, but it's consistent with the pattern that we've seen in the past, where there's a lull in the northern hemisphere summertime. Now, a question came in this week. Now that the FDA and CDC are recommending a second booster, the question is, should I mix and match my boosters? If I got Pfizer, should I get Moderna, and so on? Just to reiterate, FDA has authorized a second booster for people, older folks and folks with underlying health conditions. The CDC supports that recommendation. They went on to add that if you had the J&J vaccine, your second dose should probably be an mRNA vaccine, either Pfizer or Moderna. There was an article from the NIH which concluded, quote, a booster of a different vaccine caused similar or higher antibody response. It's a little bit difficult to follow the literature right now because many of the mix and match discussions really refer to an mRNA booster following a J&J vaccine. I showed you this slide last week, an article from the MMWR that looked at effectiveness of preventing ER visits after one dose of J&J, 2 doses, 1 J&J and 1 mRNA was very close to 3 mRNA, which is the vaccine series and 1 booster. In terms of hospitalizations, the numbers are pretty similar. Perhaps 1 J&J and 1 mRNA is a little less effective than 3 mRNA vaccines. So what's the bottom line? The bottom line is most people would recommend that your second booster be an mRNA vaccine of whatever happens to be available. I got mine yesterday. It happened to be Pfizer. That's what I had the first 3 times. If it had been Moderna, I would have accepted it as well. So the pandemic appears to be slowing down, both in terms of cases and in deaths, recognizing that the pattern has been a sawtooth pattern, go down, come back up. We'll keep our fingers crossed and see what happens. And then in terms of mix and match, I think always, as with any question like this, you should ask your healthcare provider. But if you're going to go and get your second booster, I would get whichever mRNA vaccine happens to be available. But again, talk to your healthcare advisor about it. A great deal more information about COVID-19 on the College of Public Health website. Please share these videos with anyone who might be interested, and we're happy to add them to the mailing list. Thanks, as always, to Dara Young for editing, producing, and posting this video. If you have any questions, please let me know. I really do. I try to answer your questions in return email. And then for those that I think are of broad enough interest, I'll put them in next week's update. So until next week, please be well.